I was doing the full edentulous upper and lower for a patient, and my reference was the registration that I got from a dentist. So I've put in all the teeth. The teeth are 28, and then now I'm going to do a wax up, and then I'm going to polish it nicely so that it can be ready to.
The diagnosis that we come to will then help with producing the correct treatment for the patient, and will also determine what is the prognosis of the treatment. And thank you so much for watching.
So this shows the impressions made as you can see in a lab in the form of a study model. So it's very quick, as you can see, and we can view it in all aspects, like how we can do for the study model. You can see the buccal, the labial, the occlusal aspect, and also the lingual aspect. Let me see there you go. That's the lingual aspect as well. So it's very good in the sense that a lot of time is saved and costs as well. Thank you.
You are currently in the Department of Oral Pathology. We are analysing tissue samples that the surgeons send us from theatre, from patients who have any cancerous or non-cancerous lesions. I am part of the technical team, which uses a microtome to make thin sections of tissue samples embedded in paraffin wax. Then we will use the exact band saw. It's got a diamond blade that will cut bony tissue.
We've had a wonderful morning, and we've had from various speakers, learning a lot about fourth industrial revolution from the Vice Chancellor of University of Joburg, Professor Chilizi Marwala. We heard from the Deputy Minister of Higher Education of Training on what the department intended doing and taking advantage of the emerging technologies and the new thinking. And Professor Ayo Yusuf spoke from the perspective of Sefako Makhatu University and the innovations and entrepreneurial programs that were being introduced there. Very interesting presentation. Dr. Nyalunga also spoke about the latest laser innovations and updated us on the possibilities for Sefako Makhatu University, and also shared with us the fact that some of the professionals, especially in Tshwane, were already implementing the current solutions or the emerging solutions. Now we are going to hear from the Deputy Minister of Health in a short while, who will be updating us from the COVID-19 perspective on how the department and the government sees the intersection between COVID-19, fourth industrial revolution, and higher education, and the support that is being given, as well as the new approaches on the part of the government. I'm not sure if I should take the opportunity. I know this is a health program, or conference rather, with health professionals in place, but you know, people out there in the broader society, Deputy Minister Patla, were more interested in the lifting of the lockdown for other purposes than dealing with COVID-19. They were more interested in dealing with the weekend. We're happy that government has imposed restrictions and so on, and everything is going well during the week, Monday to Friday. The greater unhappiness comes when it's weekend. So that I should convey the message from fellow South Africans that they do indeed appreciate that the weekend has been given back to South Africans. They appreciate, and they'll do their best to comply with the protocols and the advices that they've been given by the professionals. So you come here being warmly received in Tate Patla. If it were last week, maybe the attitude would have been a bit cold and more chilled than it is now. Now it's a very warm welcome that I'm giving you, because a lot of South Africans are happy now that they'll be going towards December in a much more open sense. But of course, we understand that the responsibility is still with us as ordinary people to look after ourselves as well as look after our communities and our loved ones. Well, let's not delay things any further. I welcome the Deputy Minister, Dr. Joe Patla, Deputy Minister of Health, to talk to us.
I don't know whether this thing is working.
Yeah?
Is it working?
Give mic closer. I think we can remove this completely, because you'll put it on after that. Now we have lost the mic, so let's fix it. Yeah, you see, this is exactly what is going on with the conference, that we're trying to get the technology to work with the health elements. And in practice, Dr. Patla, you can see, you know, on one hand, it's the mic that you're not sure whether it's the microphone that must be looked after more than the mask, or is the mask first and the microphone after. So, Prof?
Like to make a presentation to Mr. Modise, because he will have to leave before the presentation ends because of engagements elsewhere. So Professor Hendricks, please come forward and make that presentation while we get the technical team to be ready. Thank you.
You don't want to leave anything to chance, Prof, because I still want in the future, if I'm asked questions, to say, I don't remember, I'm not sure I was there or not, and now you want to put it on record that I was there, then video material will be produced that I was there indeed. Thanks, thanks,
Mr.
Mo.
Thank you very much.
Appreciate it.
I always seen you on TV, now I can touch you.
Thanks, thanks, bro. Well, let's not delay things any further. I've known Deputy Minister Joe Patla for a long time, and I'm pleased that he's still in the game. He's still one of our leaders in government, and he's still very active, and he's here to talk to us about the intersection of COVID-19 and technology, as well as the new approaches on the part of the government in terms of helping our society get better, look after ourselves, and improve healthcare in the country. Dr. Patla, a pleasure to have you with us.
Well, thank you very much. I hope the technology is working, looks like. Thanks to Tim, our host for this morning. Indeed, we come a long way. I think the first time he interviewed me, I was a novice MEC for health down in Polokwane at the time. And thanks for the invitation for us as the Ministry of Health to be here. Let me take this opportunity to pass the apology of my colleague, Minister Mkize, who had wanted to be here, but due to other commitments, he's been called to the Union building because there's a state visit, which is part of that delegation, which is part of that state visit with the president, so he's unable to be with us. But he indeed passed his greetings to you, to the Vice Chancellor of Sfako Makgatu, Prof. Mbati, Prof. Bayat, President of the International Association of Dental Research, South African Division, our own host here, Prof. Hendricks, the presenters, panelists. I'm told that my other old friend, Prof. Salim Abdul Karim, will also be presenting during the course of this conference. Prof. Marwala is also mentioned as one of those who is participating. So to all the panelists and presenters, good morning, ladies and gentlemen. We are indeed very pleased as this Ministry of Health to have been invited to this auspicious conference. Prof. Hendricks was just explaining that, of course, this association has also not escaped being impacted upon by COVID, and that's why you have to adapt, instead of a totally physical conference, to have a part physical but also largely online kind of a conference. I want to take this opportunity to extend our welcome to all the presenters, researchers, and I'm told there are quite a number also online from other countries. So we welcome their participation, and we're looking forward that once the COVID is over, next time they will be able to be physically in South Africa so that they can come and enjoy the hospitality of South Africans. Of course, this conference takes place at a very difficult time of the COVID-19 pandemic. And in this period, oral health is also a key indicator of the state of our health services and well-being. And we therefore welcome the taking place of this conference despite these obstacles, because we wouldn't like the pandemic to prevent us from making sure that we can assess the performance of our health services, including dental and oral, and also research in oral hygiene, dental hygiene, craniofacial research, so that we can indeed be able to advance and improve our health services. Ladies and gentlemen, we know that most oral diseases may not immediately be life-threatening, but they do affect almost everyone during part of our lives. And this results in pain and discomfort. We spend a lot of time to alleviate this pain and discomfort, spend our financial resources for treatment. For the young ones, they also lose school days, whereas for the adults, working days are also lost as a result of oral and dental diseases, and therefore productivity is affected to some degree, and social problems which affect a healthy life, for a long and healthy life, which is the motto of the Department of Health. And so what you are discussing here has a major impact in terms of that mission and vision of the Department of Health. There is indeed a need to promote oral health and oral disease prevention. It's part of the critical determinants of the prevention platform on which we can build our health services, and also as we are in the process of transforming our health services into universal health coverage under the NHI, oral and dental health, it's not only in terms of modes of detecting illness and treatment, and but also prevention and prevention of disease and promotion of oral health. Often lifestyle diseases contribute to the comorbidities, including not only in terms of other aspects of health, but also in oral and dental health. We know that especially in the young ones, it's always a struggle to keep them away from those, sugary stuff which end up, contributing to dental caries. While the significance of a healthy mouth in general health and well-being cannot be overemphasized, we indeed need to do everything to use science and research to find better ways to improve the health and well-being, and also to reduce inequalities and be able to take proactive action to make sure that we close up the gap, because otherwise in the area of dental and oral health, this gap, if we don't use this science and scientific and technological methods to close that gap, you would find that, as often happens, those who are better off, better finances, better medical cover, can get good services, whereas those in the rural areas in disadvantaged bear the brunt of some of these diseases, and they can actually deteriorate because of lack of access. Like many other countries, I believe that as a country we have taken some strides. There's still a lot which needs to be done, but we have taken some significant strides in making sure that we can prevent oral and dental diseases and promote good hygiene. But we still need to invest a lot more, and therefore we're looking forward to the papers and the discussions which have been happening since yesterday, because we believe that there's a lot which, between government and our academic institutions, there's still a lot which needs to be done to make sure that we can create basic kind of possibilities of access for all South Africans. We know that generally speaking, poor oral and dental hygiene is generally associated with those who are disadvantaged in the disadvantaged communities, vulnerable groups in the rural areas and in the informal settlements. And those are the people who we need to do everything to make sure that we can be able to create better access for them. Like the prevention and control of other health challenges, curative treatment of oral disease can be quite economically demanding, especially for those who don't enjoy the kind of medical cover which some of us enjoy. But we also know that the reason why we're striving for universal health coverage, the introduction of the national health insurance so that all South Africans can be covered, we also know that notwithstanding the fact that those who are better off and who have insured medical insurance cover, even for those, sometimes it can be quite financially draining because quite often most of these medical schemes around this time of the year, in fact, November is even very far. Some of our medical cover already by August, September, funds are depleted. So indeed, so from the financial cover side, we need to do everything through transforming the system, introduction of universal health coverage, but also from provision of services point of view, which your conference, I'm aware, is delving into quite a lot of those. We have a responsibility to make sure that we can find creative ways through which some of procedures which are currently very costly, which can be a drain even for those who are covered by medical cover, that we can, through better and improvement in the sciences and the technology in the advent of a fourth industrial revolution, that we make sure that this era of the fourth industrial revolution also makes it possible for us to find technologies which can also be of benefit for those in the lower income groups, so that some of the techniques which are able to improve the quality of life and also the quality of health, oral and dental health, can also be made affordable, so that even people in the lower income groups can be able to access those services and those technologies. So we indeed as a country need to invest a lot in prevention programs because we know that currently our health system is very much dominated by a curative approach with very little, really invested in terms of a preventative approach and promotion of better hygiene, so that people can indeed not only interact with the health services when they are already sick. Of course, as we mentioned that while we have our own challenges of transforming our health service, but we also currently, over the last 7 months or so, have to do that under a new situation, the whole situation of the COVID-19, which has brought even more complications. And we know that during this situation, which is the provision of health services. Various studies have shown from earlier on, we received a report from the Human Science Research Council, but later on also from our South African National AIDS Council also did some studies which gave us a report which indicated that especially in around April, May, and part of June, during the level 5, level 4 lockdown, many people lost their access to health services, including chronic treatments, people on medication for blood pressure, heart disease, diabetes, and also those on treatment for with antiretroviral treatment, and so there are many factors which impacted on that. Firstly, the fact that the health services had to reprioritize and attend more to those with COVID-19 infections, but also the fear of just visiting a health facility also impacted on people's access to medical services. But also, as we know, during the level 4, 5, and 3 lockdowns, even access in terms of transport also contributed. And we are aware that in that respect, access to oral and dental health was also affected because of these factors. So we indeed have to redouble our efforts as we now have moved into lower levels of restriction. We have to find ways in which we can be able to only when there is absolute pain, when you just can't bear it. That's the only time, and